Hi, everybody. My name's Kevin Rudd, the President and CEO of the Asia Society. And welcome to our original content series, Asian Americans Building America. We're speaking to many people across this country from different backgrounds who are making an extraordinary impact on their community and right across the country, and in fact, right across the globe. Today, we're delighted to be joined by Kimberly Chang, a family physician at Asian Health Services and a member of President Biden's AAPI Advisory Commission. Kimberly, tell us about your background. Where's your family from? And how did you end up in the US of A and all that sort of stuff?
Well, thanks so much, Kevin. Really honored to meet you. And thank you for the Asia Society for hosting these conversations. I'm really honored to be here with you today. I'm from Honolulu, Hawaii. I'm a multi-generational Chinese American, born and raised in Honolulu. My family goes back, depending on which ancestor, 5 or 6 generations, possibly even 7. So I'm from Hawaii. I'm a local girl.
That's fantastic. And tell us about the Asian American community in Hawaii. It's been a while since I've been there. My wife and I, Therese, honeymooned in Waikiki, would you believe? But we haven't really been back since. So tell us about the Asian American community out there.
Well, it's really interesting because Hawaii has an indigenous population, the Native Hawaiians, and which really, it has a really strong cultural identity. And that has infused a lot of the Asian American experience. I think for me, for a lot of my colleagues and friends growing up, it's very multicultural, multi-ethnic Asian groups. Growing up, if you're Asian, you're really in the majority, right? And so growing up, I didn't really feel like I was Asian American or Chinese American. I just felt like I was from Hawaii. I just felt like I was a local girl. And I think that's a unique experience. Not having to feel like you're a minority in many ways.
That's a really interesting story because it's probably unique among the 50 states of the US of A in that sense. Certainly when I had been there all those years ago, what struck me first was the sheer multicultural diversity and the predominance of Asian Americans. Now, you have spent your career working in health and serving the underserved AAPI community. What's your take on rising racism and what we're seeing against Asian Americans right now?
Yeah, thanks for the question. There is quite a bit of anti-Asian sentiment. I think, with the mixing of geopolitics and the ideas of race and how you look being associated with wherever your ancestors may have originated from, that gets very much mixed into the milieu of the United States and the culture. And I think some of that anti-Asian sentiment has translated into some of these anti-Asian, we call hate incidents or crimes or bias or discrimination in a sense. And so I think that is definitely, mixed in with the larger world politics.
Yeah, I think that's right. You see this interpolation of people's concern, for example, about the rise of China. Earlier on, it was about the rise of Japan, or you've seen it earlier in terms of attitudes towards various Muslim minorities around the United States or around what's called the Western world. And then the external geopolitics impacts on domestic attitudes towards particular groups within the great American family. So tell us about your work. You're in Oakland, California, and I understand you help those who are afflicted and affected by human trafficking and exploitation, and also in developing national health policies to address these and other AAPI health policy challenges.
Yeah, so I work at a community health center. You can see it here. It's called Asian Health Services. We're a federally qualified health center, meaning that by federal law, by federal mandate, we must serve medically underserved areas or medically underserved populations. We must serve anybody regardless of their ability to pay. We are required to have an affordable sliding scale for people who don't have insurance or who are underinsured. We must provide comprehensive primary care services. So we're not a specialty service, we're primary care. And one of the most important things about these community health centers is that we must have a board of directors, right? A board of directors who are 51%, a majority of them, have to be patients or consumers of the healthcare system that we operate. And so we're really, in a sense, driven by our local communities and the patients that we serve. They're our bosses, right? They have the power to hire and fire our CEO. And that's really important for us at Asian Health Services because, you know, we see predominantly underserved, monolingual Asian immigrants, refugees, asylees, folks who are uninsured, in poverty, don't speak English, and have really hard time navigating the systems, different systems in the United States because they're new or because they just don't have resources or they don't have the access to material access.
And how have you found in giving this sort of support to folk in the AAPI community, what sort of allyship have you been able to develop with Latino communities and with African American communities? Because many of these communities are going through parallel, in some cases, more severe challenges.
Well, I would, we don't do the oppression Olympics. So the challenges, I think, mirror each other and are the same, right? You're a minority in the community, you're under-resourced, you're in poverty, you don't speak English, whether you're Latino or African immigrant or Asian immigrant, you don't have access to systems of care and protection. And so that's across the board, especially for, human trafficking issues that I specialize in. But in terms of allyship, Asian Health Services wouldn't exist without the civil rights movement and that allyship that came out of the 60s, 50s, 60s, 70s. Community health centers across the board are allies. Now, while we have expertise in Asian health, immigrant and refugee health and language and cultural access, I still see patients who are Latino. I still see patients who are African American or Black or African immigrants. I see patients who are Native. I see white patients, right? Our expertise just happens to be intentionally in Asian languages and cultures. And so allyship is there in terms of the current racism or anti-Asian hate or the anti-Black racism that continues in the United States. There is a lot of initiatives at our health center to bring that community healing and to bring that allyship to the ground level, not just intellectually, but at our community level. For example, in February, we held some community events during Black History Month and Lunar New Year, trying to foster that ground level, grassroots, patient to patient, community member to community member interactions and understanding. And so that's some of the things that we do also in terms of community health, right? Getting along, allyship, building community, a multiracial community.
So tell me about yourself. Have you, Kimberly, ever been on the receiving end of what you describe as anti-Asian hate or discrimination in your time growing up or personally, professionally? What's been your own experience?
I think my experience in Hawaii, I think there's, I didn't really have this sense of being a minority or minoritized. I didn't have a sense of being an Asian. I just had a sense of being me in a family, in a community, in Hawaii with my friends. And so I didn't have a racial really sense until I went to college. I went to college in New York at Columbia. And it was there that I started to understand and have more of a racial conscious awakening and understanding that there were different dynamics at play, not just intellectually about, civil rights or things, but sort of interpersonally, institutionally. And for me, I don't think I've experienced any hate crimes or anything like that, but, there's sometimes different sort of ways people use language that I've noticed. And I don't think it's malicious directed at me, but it's embedded within the cultural consciousness.
Yeah, there's a fair bit of that, not just in the United States, but certainly my own home country of Australia as well. and takes a while for that to disappear. That's why we've got to push back against it as well. Tell me what it's been like being part of President Biden's AAPI Advisory Commission. Been fun? What have you been able to achieve? What are your experiences there?
Well, you know, this is all my personal reflections. I don't represent the commission at all when I'm talking to you here. I'm talking to you as Kimberly Chang, a family doctor from Asian Health Services. I love being on this commission. It's full of amazing activists, advocates, thought leaders from all different sectors, not just healthcare, right? So I'm learning a ton about labor, about small business administration, about immigration, about research and data. It's been a really fun experience, and I think it's who he selected is a testament to the kinds of ways he wants to see our community and our nation growing with different sectors represented, and really trying to work together to give recommendations on different issues affecting our communities, Asian American, Native Hawaiians, and Pacific Islanders.
That's good. Sounds like you're getting a broad enough base of experience to consider a career in the United States Congress, but that's a matter for you.
Maybe Australia.
Yeah, we're a broad church. We're a broad church. So we've just had our first Asian Australian, Chinese Australian, become our foreign minister of Australia. So we're very proud of her. Her name's Penny Wong. Now, how do you feel? Are you proud to be an American? Proud to be an Asian American? What's your sense of just, let's call it, identity and pride?
Oh, you know, I think my sense of identity and pride is more along the lines of, yes, I'm proud to be Asian American. I'm proud to be Chinese American. I'm proud to be from Hawaii. I'm proud to be a physician. I'm really proud to work at Asian Health Services here. I mean, doing really great work in from the community level all the way up to the city, county, state, and federal levels. You know, but pride is something. I'm happy to be amongst these different communities. Pride is something where you maybe rest on your laurels. And so while I'm happy to be from these communities and these groups and doing these work, I don't think the work is done, and I don't think we can rest, because there's always other folks who don't have the same opportunities and privileges and power and platform and access. And so I don't know about being proud necessarily as a resting place. I don't think that makes sense. I think
no, it does. You know, anyone who's self-satisfied in terms of where they are, I think is not going to move forward. Last question for me is, what advice do you have for future generations on what they can be doing to help counter discrimination, hate crime, or being on the receiving end of anything other than equality in this great country called America? If you're talking to a young Chinese American girl, for example, at present, what would be your advice if she gets her first experience of being uncomfortable on the school bus? There you go.
Mm-hmm. Well, you know, I think Kevin, I think you actually pointed out what could be done, which is not being self-satisfied, being civically engaged, right? Paying attention to allyship. All the questions that you asked me, I think those are the answers, right? Those are the answers. How do you be in allyship with others? That means having empathy and understanding other people's experiences. That means being motivated if you see or think of an injustice or see somebody else who doesn't realize that they don't have the same access or opportunities, that you speak up and you activate around that, because that is what America is all about, right? Equality, access, opportunity, the American dream, people being able to be self-fulfilled and contributing to this fabric of our nation, which is all of us together in community. And so I think you gave all the answers. Maybe we should just cut me out and just have you ask the questions, and that's the answers.
Don't think so. I don't think I got the street cred. A, I'm not an American, and B, I'm not.
That's true.
And I'm certainly not an Asian American. I'm one of these sort of seventh generation Anglos from Australia. So, but I do have Chinese American grandkids. So,
well, here's the thing. Even if you're not, I mean, it's about our shared humanity, right? And so, even when you talked the question earlier in the beginning, and I answered about geopolitics, right? This division, this separation, whatever it is, however we categorize ourselves, we have to break through that and recognize that we're all people with shared emotional, shared ideas of safety, security, not geopolitical security, but, in this moment, security, and feelings, right? And so that's allyship, whether it's across national, international borders or communities or down the street.
So Kimberly Chang, thank you so much for being with us today. Thank you for dedicating your career to helping those who are underserved in health. You're doing important work to lift up the most vulnerable people in our communities, and we here at the Asia Society applaud you for it. My name's Kevin Rudd. I'm with the Asia Society. Thank you for joining us today.
Thank you so much.